Good evening. I'm NBC4's Jennifer Bullock, and I'm honored to bring you a special program tonight. Over the next 30 minutes, we will address pregnancy and infant loss. It's an important topic to discuss, but I understand from personal experience, not everyone may be in the place mentally or emotionally to take part. It can be triggering for those of us who have lived through it. It's my hope that someone, somewhere, will get something from this special at some point. If now is not the time, that is okay. And you are welcome to watch it at your own pace at any time on NBC4i.com. For those of you ready now to watch, listen, and learn, this is Miles's mission. The Centers for Disease Control and Prevention defines a stillbirth as the death of a baby in the womb after 20 weeks of pregnancy. The agency also says stillbirth is more common than people may realize and remains a sad reality for many families like mine. On October 11th, 2021, at 33 weeks, my son, Miles Owen, was unexpectedly stillborn. The loss was profound, but from that pain came a new purpose, a mission. As a family, with my dad in the driver's seat, to better support other families navigating the journey through loss.
And your words were, I don't want my baby to be forgotten. I don't want Miles to be forgotten. And you know me as your dad, I pray and I just ask God for direction. And at that moment, as we are missional people, those words just came to me, Miles's mission. And so it was birthed. Obviously, we didn't know what we were going to do at that point in time, and we had no direction, no vision other than those words. And subsequently, months later, we began to go in one direction, but now we're obviously in a much larger, more impactful direction. But that was the inspiration, that was the moment, that was the time frame that we just sat there and that it seemed to fit.
With you being the president, myself the vice president, Mom's the treasurer, Pamela, my sister, is the secretary. We have a lot of official board meetings, but we also have a lot of moments where we just sit as a family and we talk about what our goal is and where we see this organization going.
Well, yeah, sometimes because the pace has been so quick and the work has been so vast that we don't stop and really assess where we are and what we've done. And when other people tell us, you've done this in less than 2 years, it's like, oh, yeah, we have. But we've done a lot of things in terms of, yes, we've supported a number of organizations that provide bears. And one of the things you've said is you left the hospital not holding anything. And so the bears are there for those moms to at least have something in their arms, or when they get home to have something to hold. There are organizations that provide boxes that have memorabilia, blankets, journals, books, and things of that nature, mugs, candles. And then those organizations that provide cuddle cots, which of course everyone knows you did not get, and that's something that was the very beginning of what Miles's mission was about. But since then, we have done so much more in terms of legislation. We have done a lot recently with the standardization in hospitals, and so that has become a major, major part. And so we're excited. Yeah, we are still in full go mode, and we're not slowing down anytime soon.
We'll hear more about moving the mission forward in a bit, but if you or someone you know is in need of resources, we have those posted on nbc4i.com/Miles's Mission. Coming up, a closer look at maternal health by the numbers and educational efforts to better support families through the birthing process. At the end of 2024, March of Dimes released its annual report card with the latest data on the health of moms and babies. When it comes to infant mortality and preterm births, the state of Ohio and the United States are essentially failing. I spoke with the nonprofit organization about the numbers and what it will take to change those outcomes and ultimately improve the health of our future families.
Every year, March of Dimes releases a report card, and the report card is really unique because it covers so many different things. So it covers not only preterm birth, but also chronic health conditions, infant mortality. It covers leading causes of infant death, maternal vulnerability, environmental factors, and so much more. So it's a very vast report card, but it really gives us a landscape of what's going on nationally and also in our state, and also it covers cities too.
According to the report card, the United States overall received a D+ for preterm birth for the third consecutive year. As a state, Ohio earned the same grade.
When it comes to preterm birth in general, some people might be thinking like, what is the cause of preterm birth, or even like how does preterm birth impact a baby? And so there are several things that can be causes from preterm birth, such as cerebral palsy, intellectual disabilities, chronic lung disease, blindness, hearing loss, and then also just a lifelong health issues. But a lot of things that we're finding in this report card are chronic conditions, specifically in Ohio, are some of the leading causes of prematurity. So that includes smoking, hypertension, unhealthy weight, and diabetes. Those are the 4 top leading causes of prematurity.
When it comes to infant mortality, more than 20,000 babies in the U.S. died before their first birthdays. Here in the Midwest, for every 1,000 live births, there are 7 or more deaths, and babies born to Black moms are dying at a higher rate.
It is definitely devastating to hear that, and just shows how much work needs to be done. And so a lot of that could be just providing more mental health opportunities for pregnant women, especially like postpartum depression and substance abuse. There's so much that can be done. I think about even on the legislative side, going to our state house representatives and asking them for money that goes to organizations like Celebrate One. There is definitely a plethora of things that can be done, but it's definitely exciting. It's an exciting time, even though it can be overwhelming and frustrating with all the things that are happening right now. But I do have hope that we can really make a difference.
Speaking of racial disparities, Black women are 4 times more likely to experience maternal-related complications. That statistic is just one of the reasons Uplift Her was created, to provide wellness resources for women. The program falls under the umbrella of the National Center for Urban Solutions, which is also working to secure an educated workforce when it comes to maternal health and infant well-being through its community-based doula training program.
So over the years, there have been some studies done that understand that having birth support helps to reduce unnecessary interventions, helps to reduce C-sections, increases mother-baby bonding, increases breastfeeding success. And so it's better understood that every birthing person deserves to have the support of a doula.
And as a trained and certified doula and now instructor, Destiny Daniels can speak to that from experience.
The very first time I attended a birth, I was probably about 17 years old, supporting a best friend, and that kind of sparked that fire. And then later on, once I had my own child, and just the overall experience, it wasn't terrible, but there could have been some support there that was definitely needed. That definitely lit the fire for me to go ahead and take my first training. And over the years, I have supported many families in a variety of circumstances. So I've been to home births, hospital births. I've even sat in on a C-section before. And so this has been a rewarding journey just to see the different experiences of the families, to really also see the empowerment of the families, because part of the work of a doula is education. As the doula instructor here at NCUS Tech, I train doulas. We have an 8-week program. It is roughly 60 clock hours where the students are actually coming in, they're getting hands-on training. We're covering a spectrum of things. So we are covering like reproductive justice, the history of doulas, and how we kind of got started here in the United States,
as well as pre- and postnatal support, including bereavement care.
We really made sure to add that into our curriculum so those doulas know how to support their family and also understand the importance of even them getting support afterwards to process through. And so it's a full, I would say, wraparound service where they're feeling really supported during their journey.
And you can learn much more about NCUS Tech's doula program and other ways to prioritize your health at Uplift Her Women's Wellness Day, June 18th at the Ohio Expo Center. After the break, I sit down with another local mom to talk life after loss and how she's using her voice to help other families grow. Carrie Croft is an Ohio-born Buckeye grad, podcast host, and mom. We first connected when she asked me to appear as a guest on her show as she was preparing to launch a series about infertility and child loss. That's when I asked her some questions about her story, her fight to grow her family, and her mission to help others do the same.
Well, my name is Carrie Croft, and I'm from Lima, Ohio, an hour and a half away from here. I went to Ohio State. Yeah. I had a business for the last 10 years in the fitness world. I just sold my interest, and I have the show now called The Carrie Croft Show.
So I do want to talk about the topic that brought us together, which is motherhood.
My family was built on the back of art technology, so assisted reproductive technology. I would not have my family were it not for the doctors and nurses and the altruistic people in my community that have helped push my husband and I forward to have this beautiful family. My infertility journey started in 2006. I mean, there's so many things that we went through. Lost, 2 little girls were stillborn, Angel and Hope, and then we had one, Jade, that lived, fought hard in the NICU for 16 days. So we went through infertility. We lost Angel immediately after we got married, had unexplained infertility for a very long time. I became like the Erin Brockovich of figuring out the issues. I mean, I know way too much about way too many things when it comes to that stuff. Luckily, with persistence and my relentless spirit, we were able to have Dane, who is 6.5, and then we just had my little girl Kyle via surrogate. She's 19 months old.
So tell me a little bit about your surrogacy journey.
Yeah, so, when we decided to get pregnant with Hope, the conversation was there about a surrogate. Mm-hmm. I was older. Should we do a surrogate? That's a very scary thing to think about. And so we proceeded to move forward. And when things went wrong with Jade, it's just etched in my brain. And he and I were in the room, and it was a couple of hours later, and I looked at him and I was crying. I'm like, this is how it ends? Mm. This is how it ends. After everything we've gone through, and we have this beautiful boy, which I'm so grateful for, but this is how it ends? Yeah. And he said to me, I'll never forget. I mean, it's one of those moments where you can I can hear him. Mm-hmm. He's like, you know what? You've spent the last 10 years building this family on your back while I basically had my thumb up my, go get your surrogate. And I started making these Zoom calls with these agencies, feeling like I was betraying Jade, feeling horrible. And I just thought to myself, take off the grief hat and put on the get done hat. That's because there's duality.
Yeah.
So I decided then, because my business mind is always going, right? And I was like, I'm going to peel back this model and figure out what's happening here with the agency. And I am not here to say the agency is bad. Right. There's nothing about an agency that's bad. That's a route to take. Mm-hmm. But I don't believe it's the only route to take. And I think it's very alienating for your average human being who cannot afford from a financial or from a time perspective to go that route. And so once I peeled back the model and I figured out, okay, here's exactly what's going on. Here are the costs. Here's their margin. Here's what the surrogate's getting paid in the market. I'm like, all right, pump the brakes.
Yeah.
So I went through step by step, found my dream surrogate, and then I thought to myself, this was actually a really smart way to handle this.
Yeah.
And as this show has been progressing, people have started to hear like, oh, ask Carrie about surrogacy, ask her about infertility. Well, then when that was happening, I'm like, well, why don't I create this workshop and this space where someone could come and do it the way I did it. So I created the Find Your Dream Surrogate Workshop. And it is just packed with every single detail that I did to find my surrogate. You at home have every right to build your family the way anybody else does. And so if I can give you a bridge to that without it adding this financial catastrophe on top of everything else, I am here for it. For whatever reason, life has presented me as this expert in this space that I never would have asked to be on this team. I never would have asked to be in this space, but now that I am, I'll be damned if I don't do something with it that helps somebody else.
To contact Carrie or to find out more about her podcast, her workshop, and to hear our entire conversation about life, loss, and more, go to nbc4i.com/Miles's Mission. Up next, what's next for Miles's mission in Ohio and beyond? As I mentioned earlier, it's been 3.5 years since my son Miles's death, and almost 2 years since my family established our mission in his name to better support and implement change for other families navigating loss. A lot of work has been done, a lot of progress has been made, but our mission is still moving forward.
So let's talk a little bit about some of the things that we have done, but also some of the things that we are working on.
Yeah, we've done a lot of things in terms of, yes, we've supported a number of organizations that provide bears, organizations that provide boxes that have memorabilia, blankets, journals, books, and things of that nature, mugs, candles, and then those organizations that provide cuddle cots. But since then, we have done so much more in terms of legislation, working together, you and I, more specifically in seeing House Bill 4, and hopefully here soon we'll see it to its conclusion. We have done a lot recently with the standardization in hospitals, working with the Central Ohio Hospital Council and many of the staff and nurses and practitioners at the various hospitals in Franklin County to begin to make sure that every family gets proper care and consistent care no matter where they go. And where we're going is in Muskingum County. We are trying to develop a Miles Mission Memorial Park. We have partnered with our Parks District there, and we're excited about it because in 2025 we plan on opening it with an Angel of Hope statue, gazebo, benches, and even a play area for children so that families can have somewhere to go and spend time with their angel baby. Also, I just finished my second book, which hopefully comes out this year, Waves of Grief. We're doing a children's book, Miles Loves Ducks, and so we're excited. Yeah, we are still in full go mode, and we're not slowing down anytime soon.
Not anytime soon, and I think it is really important for people to know that this comes from a place of true love, and I think that this is really healing for us to be able to make sure that Miles has a legacy.
We're not in this for us.
Yeah.
We are in this for those families that we might not meet in California, Kansas, Utah, Florida, New York, Georgia, places we've sent cuddle cots or bears or boxes, or my book has been overseas as well. And yet, Miles, as you said, he's more known than we are.
Yeah.
Because his name is in all of those places, and those families are being helped by his name and by his purpose. And so we are still healing, but we are also very, very thankful that for whatever reasons we were chosen for this assignment. And but the thing that has brought me the greatest of solace is know that for this little bit of time that I miss Miles, I have all eternity to spend with him.
Agreed. Thank you. Love you.
Love you too.
Be sure to follow along as our mission moves forward. As you heard, there's a lot in the works, including several upcoming events. And if you or someone you know would like to learn more, or if you're in need of resources, visit nbc4i.com/miles'mission. And I'd like to take a moment to thank my family, our friends, and our supporters helping us to soldier on. Thanks to Ohio Health Co-Backer House, March of Dimes, NCUS Tech, and Carrie Croft for participating. And to my incredible NBC4 team for giving Miles a platform to make a lasting difference. Because every life matters. Good night.